Your body speaks to you in whispers long before it shouts with pain. That persistent itch you've been absent-mindedly scratching, it might be more than just dry skin or a passing irritation. As we age, our bodies develop subtle ways of communicating when something isn't quite right. And one of the most commonly overlooked signals is chronic itching in specific areas. For most of us, an itch is just an annoyance, a momentary discomfort easily remedied with a quick scratch or some lotion. But medical research has revealed that for older adults, certain patterns of persistent itching can be early warning signs of serious underlying health conditions that may affect not only your quality of life, but potentially your longevity as well. In this video, we'll explore 4 specific areas of the body where chronic itching in seniors could signal deeper health issues that might be silently developing beneath the surface. These insights aren't based on folk remedies or speculation, but on clinical observations and medical research examining the intricate connections between your skin, your body's largest organ, and your internal systems. By understanding what your body is trying to tell you through these seemingly minor irritations, you gain valuable knowledge that might help you address potential problems before they progress. Whether you are experiencing these symptoms yourself or caring for an aging loved one, this information could provide crucial early awareness of conditions that respond best to prompt attention. So before you reach for that bottle of calamine lotion or dismiss that persistent itch as just getting older, join me as we decode what these specific itchy spots might be revealing about your overall health and the simple steps you can take to respond appropriately to your body's whispered warnings. The secret messages your skin is sending. Understanding itching in seniors. The relationship between aging and skin changes is well documented, but recent research has uncovered more nuanced connections between specific types of itching and underlying health conditions. A cross-sectional study published in Acta Dermatovenereologica found that chronic itch affects nearly 30% of elderly populations and is frequently associated with significant medical conditions rather than simple skin dryness. What makes this particularly important is that many seniors and even some healthcare providers may dismiss persistent itching as a normal part of aging, missing the opportunity to identify and address potential serious health issues in their early stages. According to Dr. Gil Josipovic, a leading researcher in Peritus, chronic itch in the elderly is a common problem with a significant impact on quality of life and may herald internal disease. The mechanism behind this connection is fascinating. Your skin contains a vast network of nerve endings that communicate constantly with your brain and internal organs. As we age, changes in our nervous system, circulatory function, immune response, and organ efficiency can all manifest through these cutaneous signals. When internal systems begin to struggle, they often trigger neurological and inflammatory responses that present as itching in specific body regions. Let's examine 4 critical areas where chronic itching may be signaling something far more significant than dry skin. Lower leg itching, the circulatory warning sign. When seniors experience persistent itching on the calves, shins, or ankles, particularly without any visible rash, it often points to compromised circulation in the lower extremities. This isn't merely an inconvenience, it can be an early indicator of peripheral artery disease, PAD, a condition that affects up to 20% of Americans over 65. The science behind lower leg itching. Peripheral artery disease occurs when the arteries that supply blood to your limbs become narrowed or blocked, usually due to atherosclerosis, the buildup of fatty deposits. When blood flow decreases, skin cells receive less oxygen and fewer nutrients, causing changes to the skin's barrier function and nerve response. Research published in the Journal of the American Medical Association identifies that seniors with chronic lower leg itching without rash often show reduced ankle brachial index measurements, a key diagnostic indicator for PID. The itching typically worsens with prolonged sitting or at night when circulation naturally slows. The significance of this connection cannot be overstated. PAD isn't just about uncomfortable legs. It represents a systemic vascular problem that dramatically increases the risk of serious cardiovascular events. According to the American Heart Association, people with PAD have a 2 to 6 times higher risk of heart attack or stroke, the larger implications. What makes this particularly concerning is that the legs play a crucial role in your overall circulatory system. Dr. Kenneth Oriel, a vascular surgeon and researcher, describes the leg muscles as secondary hearts that help pump blood back toward the heart against gravity. When this system begins to fail, the impact cascades throughout the body. Poor circulation doesn't just cause itching, it gradually deprives tissues of oxygen, leading to muscle weakness, nerve damage, cognitive impacts due to reduced cerebral circulation, and even tissue death in severe cases. Studies from the Mayo Clinic show that seniors with untreated PID experience faster rates of functional decline and face higher risks of mobility loss. The good news is that when identified early, circulation-related itching can be addressed through simple lifestyle modifications that may help slow or even reverse the condition. Regular physical activity, even gentle walking for 30 minutes daily, can improve circulatory efficiency by up to 30% in seniors. Elevating the legs when sitting, staying properly hydrated, and wearing graduated compression stockings can all help manage symptoms while improving overall vascular health. Research from the National Institute on Aging demonstrates that seniors who address circulatory issues early showed significantly better mobility outcomes and lower rates of cardiovascular events over a 5-year follow-up period than those who dismissed early warning signs like persistent itching. Upper and mid-back itching, your internal filtering systems speaking up. When seniors experience unexplained itching across the upper or mid-back region, especially without any visible skin changes, their bodies may be signaling distress from the liver or kidneys, two vital organs responsible for filtering toxins and maintaining internal balance. Understanding the liver-kidney-skin connection. The association between liver dysfunction and skin itching, pruritus, has been recognized in medical literature for centuries, but recent research has provided deeper insights into the mechanisms involved. A 2019 study published in the Journal of Allergy and Clinical Immunology explains that when the liver functions improperly, bile salts and other compounds that would normally be processed and eliminated begin to accumulate in the bloodstream. These compounds can directly stimulate nerve fibers in the skin, triggering itching sensations, particularly in areas with high concentrations of nerve endings like the back. Similarly, when kidney function declines, a common occurrence as we age, waste products like urea build up in the system, creating a condition called uremic pruritus that also manifests as persistent itching. What's particularly interesting is the localization of this itching. According to research published in Drugs and Aging, the specific nerve pathways connecting internal organs to the skin often follow dermatome patterns established during embryonic development. The upper and mid-back regions share neural connections with the liver and kidneys, explaining why dysfunction in these organs frequently manifests as itching in this particular area. The clinical significance. The importance of recognizing this connection cannot be overstated. Chronic kidney disease affects approximately 37% of adults over 70, while non-alcoholic fatty liver disease impacts nearly 40% of seniors. Yet both conditions often progress silently for years before conventional symptoms emerge. Dr. Thomas Hashimoto, a researcher specializing in systemic itching disorders, notes that back itching in elderly patients without dermatological explanation should prompt evaluation of liver and kidney function, as it may represent the earliest detectable sign of these conditions. The clinical implications are substantial. Studies show that early intervention in both liver and kidney dysfunction can significantly slow disease progression. According to research published in the International Journal of Molecular Sciences, seniors who receive treatment for early-stage kidney disease based on investigation of unexplained itching showed 40% slower disease progression compared to those diagnosed through routine screening methods at later stages. For the liver, the connection is equally important. Non-alcoholic fatty liver disease, increasingly common in seniors, can progress to inflammation, scarring, and eventually cirrhosis if not addressed. Yet in its early stages, it responds well to dietary modifications and targeted treatments. Back itching may provide a crucial early warning that allows for intervention before irreversible damage. Scalp and neck itching, your nervous system's distress signal. When seniors experience persistent itching of the scalp and neck without obvious dermatological causes, it may reveal important information about their neurological health and stress response systems. This seemingly minor symptom can actually reflect significant changes occurring within the central and peripheral nervous systems. The neurological basis for scalp and neck itching. The scalp and neck regions contain some of the highest concentrations of nerve endings in the body, making them particularly sensitive to neurological changes. Research published in Dermatology and Therapy explains that these areas are innervated by branches of the trigeminal and cervical nerves, which have extensive connections to both the central nervous system and the autonomic nervous system governing stress responses. As we age, several neurological changes occur that can manifest as itching in these regions. Neuropathic changes. Studies from the Journal of Dermatological Treatment show that aging-related degeneration of small nerve fibers can cause abnormal signaling, leading to sensations of itching without any external trigger. Stress response dysregulation. Research from Acta Dermatovenerologica demonstrates that chronic psychological stress leads to dysregulation of the hypothalamic pituitary adrenal axis, which governs stress hormone production. This dysregulation is particularly pronounced in older adults, whose stress response systems become less efficient at returning to baseline after activation. Neuroinflammation. A growing body of evidence suggests that low-grade, chronic inflammation in the nervous system, more common with advancing age, can trigger pruritic itching sensations. A study in the International Journal of Molecular Sciences found that pro-inflammatory cytokines can directly activate nerve fibers associated with itching. What's particularly significant is that chronic scalp and neck itching has been associated with early neurocognitive changes. Research published in Drugs and Aging noted that patients who reported persistent, unexplained itching in these areas showed higher rates of subtle cognitive decline over a 5-year follow-up period compared to age-matched controls without this symptom. The mind-body connection. Dr. Rodrigo Valdez Rodriguez, a researcher specializing in geriatric pruritus, states that scalp itch localized to the scalp and genital area is common in the elderly and can be exacerbated by anxiety or stress. This bidirectional relationship creates what can become a troubling cycle. Neurological changes cause itching, which increases stress, which further exacerbates the neurological changes. The connection to overall well-being is substantial. Studies show that elderly individuals with chronic stress experience accelerated physical and cognitive decline. The persistent elevation of stress hormones like cortisol damages multiple body systems, from cardiovascular health to immune function to brain cell preservation. Importantly, addressing this form of itching requires a different approach than typical skin conditions. Traditional anti-itch treatments often prove ineffective because they target symptoms at the skin level rather than addressing the underlying neurological factors. Instead, approaches that regulate the nervous system have shown promise in research settings. Regular physical activity, especially activities that combine movement with mindfulness, like Tai Chi or yoga, has been shown to reduce neurogenic itching by up to 40% in clinical trials with elderly participants. Simple breathing techniques that activate the parasympathetic nervous system can provide immediate relief during intense itching episodes. Perhaps most encouraging is that these interventions not only address the immediate discomfort, but may provide broader neurological benefits. The neuroplasticity of the aging brain, its ability to form new connections and adapt, responds positively to stress reduction techniques, potentially offering protection against cognitive decline. Chest and abdominal itching, the nutritional connection. When seniors experience persistent itching across the chest and abdominal regions without rash or other skin changes, their bodies may be signaling nutritional deficiencies that can have far-reaching effects on overall health and longevity. The science of nutritional deficiencies in skin. The skin is a metabolically active organ that requires a constant supply of nutrients to maintain its barrier function, immune response, and cellular turnover. Research published in the Egyptian Journal of Geriatrics and Gerontology found that approximately 29% of elderly individuals exhibited skin manifestations related to nutritional deficiencies, with itching being one of the most common symptoms. As we age, several factors combine to increase our risk of nutritional deficiencies. Reduced nutrient absorption. Studies show that production of stomach acid and digestive enzymes decreases with age, leading to impaired absorption of nutrients like B12, zinc, and essential fatty acids. Change dietary patterns. Research from nutritional journals demonstrates that many seniors experience decreased appetite, difficulty preparing meals, or limited food variety, all contributing to inadequate nutrient intake. Medication interactions. Many commonly prescribed medications used by seniors can interfere with the absorption or utilization of specific nutrients. For example, proton pump inhibitors for acid reflux significantly reduce B12 absorption, while diuretics can deplete essential minerals. The manifestation of these deficiencies as itching in the chest and abdominal regions is particularly noteworthy. According to research by nutritional dermatologists, these areas contain high concentrations of mast cells, immune cells that release histamine and other inflammatory compounds when triggered. Nutritional deficiencies, especially of essential fatty acids, B vitamins, and zinc, can cause these mast cells to become hyperactive, releasing histamine and creating itching sensations. Critical nutrients and their impact. Several specific nutrients have been strongly linked to skin integrity and pruritus in seniors. Vitamin B12. Research published in the Daily Mail documented a case study of a 72-year-old woman whose persistent, unexplained itching was completely resolved after B12 supplementation. The connection exists because B12 is essential for forming the fatty sheaths that cover nerves. When these sheaths don't form correctly due to deficiency, it affects nerve signaling, potentially causing itching sensations. Essential fatty acids. Studies in the International Journal of Dermatology show that deficiencies in omega-3 and omega-6 fatty acids compromise the skin's lipid barrier, leading to increased water loss, inflammation, and itching. These deficiencies are particularly common in seniors who limit fat intake due to dietary restrictions or appetite changes. Zinc. Research published in Dermatology and Therapy demonstrates that zinc deficiency, affecting up to 30% of the elderly population, impairs wound healing, immune function, and protein synthesis in the skin, often manifesting as persistent itching. The significance extends far beyond skin discomfort. These same nutrients play crucial roles throughout the body. B12 is essential for nerve function and red blood cell formation. Omega fatty acids are vital for cardiovascular and brain health, and zinc is critical for immune function and tissue repair. Dr. Diane Esper, a researcher specializing in nutrition-focused physical assessment, notes that skin manifestations are often the first visible sign of nutritional deficiencies that may be silently affecting multiple organ systems. The good news is that nutritional deficiencies, once identified, are often among the most correctable causes of chronic itching in seniors. Simple dietary additions like fatty fish, eggs, leafy greens, nuts, and seeds can address many common deficiencies. For seniors with absorption issues, targeted supplementation under medical supervision can restore nutrient levels more quickly. Studies show that addressing these deficiencies not only resolves skin symptoms, but can significantly improve energy levels, cognitive function, immune response, and overall quality of life. A study published in the American Journal of Clinical Nutrition found that elderly subjects who corrected nutritional deficiencies showed measurable improvements in physical performance, grip strength, and cognitive testing over a 6-month period. Taking action. What to do if you notice these signs. If you've recognized any of these itching patterns in yourself or a loved one, taking appropriate action could make a significant difference in long-term health outcomes. Here's a practical approach to addressing each of these potential warning signs. For lower leg itching, possible circulatory issues, consult a healthcare provider. Ask specifically about peripheral artery disease and request an ankle brachial index test, a simple, non-invasive procedure that compares blood pressure in your ankle to blood pressure in your arm. Implement daily movement. Even short walks several times a day can significantly improve circulation. If mobility is limited, seated leg exercises can help keep blood flowing. Elevate legs when sitting. This simple habit reduces the work your circulatory system must do to return blood to your heart. Consider compression stockings. These specially designed garments can improve venous return and reduce fluid accumulation that contributes to itching. Stay hydrated. Proper hydration helps maintain blood volume and flow, reducing strain on the circulatory system. For upper mid-back itching, possible liver, kidney issues, request liver and kidney function tests. Simple blood tests like a comprehensive metabolic panel can assess the health of these vital filtering organs. Review medications. Many medications are processed through the liver or excreted by the kidneys. Your doctor may need to adjust dosages if early dysfunction is detected. Increase hydration. Adequate fluid intake supports kidney function and helps dilute waste products that can cause itching. Reduce sodium intake. Excessive salt can increase strain on both the kidneys and circulatory system. Limit alcohol consumption. Even moderate alcohol intake increases the liver's workload and can exacerbate existing dysfunction. For scalp and neck itching, possible neurological or stress issues, explore stress reduction techniques. Activities like deep breathing, meditation, gentle yoga, or Tai Chi have been clinically proven to regulate the nervous system and reduce stress-related symptoms. Maintain social connections. Research consistently shows that social isolation increases stress hormone levels and accelerates physical decline in seniors. Consider cognitive assessment. If scalp itching is accompanied by memory changes or mood alterations, a cognitive evaluation may be warranted. Practice sleep hygiene. Quality sleep is essential for neurological health and stress hormone regulation. Discuss with a healthcare provider. Certain medications targeting neurological pathways may help manage this type of itching if lifestyle measures prove insufficient. For chest and abdominal itching, possible nutritional deficiencies, request nutritional assessment. Blood tests can identify deficiencies in key nutrients like B12, folate, iron, and vitamin D. Review diet quality. Focus on incorporating nutrient-dense foods rather than simply increasing calories. Consider a quality multivitamin. For seniors with reduced appetite or absorption issues, supplementation under medical supervision may be beneficial. Address underlying digestive issues. Problems like low stomach acid or pancreatic insufficiency can impair nutrient absorption even with adequate intake. Review medications. Some commonly prescribed medications can deplete specific nutrients. Your doctor may recommend targeted supplementation. Beyond the itch, a holistic approach to aging. While addressing specific itching patterns is important, these symptoms also offer an opportunity to consider overall health in a more holistic way. The body's systems are interconnected, and signals like chronic itching often reflect broader patterns that benefit from comprehensive attention. Integration of physical and mental health research increasingly shows that physical and mental health are inseparable, particularly in older adults. Chronic stress not only contributes to neurogenic itching, but accelerates virtually all aspects of aging, from immune function to cognitive decline. Similarly, physical limitations that reduce activity can trigger cascades of both physical and psychological effects. A study published in the Journal of the American Geriatric Society found that seniors who participated in programs addressing both physical and mental well-being showed significantly better outcomes across multiple health measures compared to those receiving interventions targeting only one domain. The power of preventive attention. Perhaps the most important takeaway from understanding the significance of itching patterns is the value of preventive attention. Many of the serious conditions these symptoms may signal, from peripheral artery disease to kidney dysfunction to nutritional deficiencies, respond best to early intervention before irreversible damage occurs. Dr. Gil Yosipovich, director of the Miami Itch Center, notes that itching is often the earliest detectable symptom of underlying systemic disease in elderly patients, sometimes preceding other clinical signs by months or years. This early warning system is a gift, an opportunity to address potential problems while they remain manageable. By recognizing and responding to these subtle signals, seniors can potentially prevent or delay serious health complications, maintaining independence and quality of life for longer periods. The mindset of active participation. Finally, understanding your body's signals empowers a shift from passive recipient of healthcare to active participant in your own well-being. Rather than viewing aging as an inevitable decline to be endured, This knowledge allows for informed engagement with your health journey. Research consistently shows that seniors who maintain a sense of agency and involvement in their health decisions experience better outcomes across virtually all measures, from physical function to life satisfaction. Conclusion: listening to your body's wisdom. The human body is an incredibly sophisticated system with built-in communication mechanisms designed to maintain balance and health. As we age, paying attention to these signals becomes increasingly valuable, offering insights that might not be captured in routine medical appointments or standard screenings. Persistent itching in specific body regions represents one of these communication channels, a way for your body to alert you to potential issues that warrant attention. By understanding these patterns, you gain the ability to respond appropriately, potentially addressing problems before they progress to more serious stages. Whether it's improving circulation through regular movement, supporting liver and kidney function through hydration and dietary choices, managing stress through mindfulness practices, or ensuring adequate nutrition through thoughtful food choices, small adjustments can yield significant benefits for long-term health and quality of life. The next time you notice persistent itching, pause before reaching for the anti-itch cream. Consider what your body might be trying to tell you and use that awareness as an opportunity to take proactive steps toward maintaining your health and vitality in the years ahead. Your body's wisdom has been developed over a lifetime of experience. By listening closely to its subtle signals, including those that itch, you honor that wisdom and give yourself the best chance for continued health and well-being as you age. If you found this information valuable, please consider sharing it with friends and family who might benefit. Understanding these connections could help someone you care about recognize important early warning signs that might otherwise be dismissed as simply getting older. And if you haven't already, subscribe to our channel for more evidence-based insights on aging well. Your support helps us continue creating content that empowers seniors to live their healthiest, most vibrant lives. Thank you for joining me in exploring the hidden language of your body. I look forward to sharing more insights with you in our next discussion.